I'm John Gentili. I'm a board certified physician here at South County Urgent Care. We're located here in San Clemente, just by the Taliga Golf Course, just past Walmart and that string. We're here on Amanita Vista Hermosa. We've been here since 2002, so we have a long history of supporting our community here.
So doctor, tell me what got you into running a urgent care?
Well, my background's always been emergency medicine. It's the only medicine I practiced. And then there was always a need when in the ER, about 23% of the people who are in the ER are the ones who need to be there. The rest could be seen in a different setting. And so when you go in with something, what the ER would call minor, they have to sit and wait for the majors, and it was a lot of time. So we came up with the idea of creating this urgent care back in 2002. And so we've been here ever since.
How should someone decide to come into an urgent care as opposed to going to the ER or going to their doctor?
Certainly getting into their own doctor is always nice, but they're often booked. Number two, you can always call us and say, this is what I'm having, what do you recommend? Or just come in, and often people will come in and I'll evaluate them, and sometimes I say, you know what, you need to be in the ER. And that's nice for them because then when they're there waiting, they know they need to be there. It's not just a, should we be here, not be here, let's leave. And that can create, obviously, problems. So they can come in, be quickly evaluated, and determine if this is the right place or not.
How did you pick this area for a location for your urgent care?
Well, back in 2002, there was nothing down here at all, just the new developments, and so it was an area that needed, was well located for the population. It was a bit of a travel up to the hospital, and so we started here, and it's kind of grown up around us.
I heard you won the Best of San Clemente Business Award a couple years in a row. How did you accomplish that?
Well, our patients are pretty loyal, and they write in and say, this is the place. It's the only ER with only physicians who treat patients, so we have a pretty solid community that supports us and is here, and they like the service we offer.
I imagine there's been times where you've actually saved someone's life here.
Well, yes. I mean, it's always a team effort between us and the paramedic team and the hospital, but we're pretty good at it. We're both ER doctors, so we have a good feel for what needs to be done quickly, efficiently, and critically when needed.
Doctor, how many years have you been practicing?
Too many to count. Thank you very much.
What makes you stand out compared to the other urgent cares in the area?
Well, I think first of all, having physicians who have trained in ER, practiced ER, have a real practiced eye for what needs to be done, the more complex things, the balance between what's needed, what can be done here quickly, efficiently. Also, we don't do a lot of testing unnecessarily. In fact, we don't do any unnecessary testing. Pretty much if there's a test we need right now, we get that. If there's a test that we can't do here, we either don't need it or it needs to go to the ER. So we don't, kind of like going to the car to the garage where for a tune-up and they find 7 things that you need. We're here, we take care of you for what you need, and then we get you back to your regular physician.
Do you have any unique services that you provide here?
Well, we do offer here with the C-Point next door. We do both testosterone implants, facial rejuvenation, pellet, RPR, PRP. We do a number of other physical. We do a lot of wellness. Functional medicine is done as well in conjunction with our colleagues here.
Doctor, can you explain what PRP is?
PRP is platelet-rich plasma, which is a method we use to draw blood, spin it down, and take the platelets, which are responsible for rejuvenation, healing. So when you cut yourself, the platelets are what come to the area and regenerate the tissue, the nerves. And we use that in both facial, for hair growth, for a number of processes. They use it in cataract surgery, obviously not here, for shoulders, joint not replacement, but healing, muscle growth, rejuvenation. So it's a pretty common and up-and-coming procedure.
So doctor, I've heard that people come here and they feel very comfortable and safe. Is that something you've done by design?
Well, our philosophy here is you should feel better from the minute you walk in. And I think that's evident from the time you walk in, from the front office through the physician and the nursing staff. We take great pride in how people feel here.
Doctor, other than people walking in for urgent care, do you provide primary care here?
We have many patients who use us as their primary care because especially the younger generation, they have more episodic care. So they use us as their primary care. So, and we also offer appointments if people have a busy schedule, and we're managed to keep on that within 20 minutes. So yes, we do have patients who use us as their primary care.
Doctor, what's the experience for someone who walks into your offices?
I think even if you look at the website and the reviews on Google, you'll find the most common response is everybody is so friendly here, informative, and it's efficient. They're not a long wait. They feel good coming here. They are sick, and when they leave, they feel just a little bit better. I think one of the things that patients find impressive and is most important to us here as the staff is that connection we make with the patient. They're not just a laceration in room 3. They're Bob who sliced his finger while cutting the turkey, and we make that connection as we talk with them and go through that experience. And when they leave, they feel like they were talking to almost a family member, explaining what happened. And they feel that, and when they come back, that's one of the things they say, I come back because I feel like your family. One of the things that we find, we don't do much advertisement because our patients are our advertisement. They talk to their friends, family, even visitors. Oh, that's where you want to go. And that's how we build that. That's that connection that patients have with us and we with them.
Doctor, what do you tell somebody who feels nervous about going to see a doctor or getting medical attention?
You know, I hear that a lot. Patients, out 7, 10 days of an illness, even longer. I say, why did you wait? We're here. If you come in, we'd be all better now. And they say, I'm a little afraid, the cost, or, people laugh at me, they'll think something ill. Look, it's much easier to weed and water than put out a forest fire. So come in. If the cost is an issue, we are the least expensive urgent care. We are the only place for physicians. We will work with you because it's more important for us to build that connection where you're a place you can come, even call and say, what should I do? We're here. We're part of this community. We're not a business. We are part of the community.
Doctor, is it possible to make an appointment online?
Yes, you can go on our website, you make an appointment online, you call up, make an appointment online. It's easier just to make it online if you like. We're very good about getting people in, but we are pretty fast just walking in. The wait time, like I said, it's in out on average 23 minutes.
Doctor, I understand that's important to be part of a community when you're in business. How does South County Urgent Care fit into this community?
Well, we're certainly a beach community. We see a lot of surfing, surf accidents, lacerations, hiking, biking, pickleball. We have it all here. So we're here to provide that, but the community also supports us. We support the community by doing things outreach in the community to be there for them. At the various school events, I often provide physician for the high school sports teams. And so it's a really, I don't want to say symbiotic relationship, but when you're part of a community, that's a big responsibility. It's not just we're here to take your money like many other places, but we are part of that community, and I think there's a strong feeling of that, and I think that's why we're successful.